Good afternoon, folks. This afternoon's topic A is Americans live with long-term health issues from blood pressure to diabetes, signaling a widespread entrenched burden of chronic diseases. So that's what we're discussing this afternoon for topic A. Please join me in today's discussion A. The page frames a sweeping, urgent narrative. Nearly 200 million Americans live with long-term health issues from high blood pressure to diabetes, signaling a widespread, entrenched burden of chronic diseases. That's the backdrop for the 3 and 4 claim. It's meant to convey scale and crisis, emphasizing that chronic conditions are no longer the exception, but the norm among U.S. adults. What counts as a chronic condition on this page? Chronic conditions are described as illnesses lasting a year or more that restrict daily life and or require ongoing medical care. Examples include heart disease, cancer, diabetes, and Alzheimer's. This definition, commonly used by public health agencies, helps explain why the prevalence numbers can be so high when multiple conditions are counted per person and when both physical and mental health conditions are included. United States Joint Economic Committee. How the 3 and 4 claim compares to common estimates. Typical range. Many reputable summaries estimate about 6 in 10 U.S. adults have at least one chronic condition, with a significant share having multiple conditions. Several policy and research briefs cite the 60% figure as a baseline prevalence point. NIHCM, the American Action Forum, United States Joint Economic Committee. Why higher on this page? Media pieces sometimes cite newer surveys or broader condition lists. Including more cardiometabolic risks, mental health, and musculoskeletal conditions, which can push estimates higher. The page is nearly 200. The page The page is nearly 200 million, framing fits a higher end prevalence narrative, aligning with the crisis language, even if it exceeds the more commonly quoted 60% MSN, NIHCM, United States Joint Economic Committee. The stakes emphasized by the surrounding content. Financial burden. Around 90% of U.S. healthcare spending goes to care for people with chronic and mental health conditions, underscoring systematic costs and the pressure on payers and providers. NIHCM, United States Joint Economic Committee. Mortality and daily impact. Chronic conditions account for a large share of deaths and sustainability affecting daily functioning, highlighting why the page treats this as a national crisis rather than a niche concern. United States Joint Economic Committee. Equity lens. The distribution isn't uniform. Lower income communities and people of color shoulder disproportionate burdens due to structural barriers, and reinforcing the call for targeted interventions and policy reform. United States Joint Economic Committee. Geographic and societal demographic context behind the headline. Research mapping chronic disease by zip code shows marked variation across regions and populations. Connecting chronic disease prevalence to social detriments like income, education, and access to care. This context helps explain why national averages, whether 60% or 75%, mask localized hotspots and persistent disparities that the page's crisis framing ties to the Spotlight CDC quick verdict. The headline: three in four American adults now have chronic conditions, uses an expansive crisis-oriented frame backed by high prevalence and cost narratives, while many authoritative give me 1 second. sources cite closer to 10 to 6 to 10 adults. On the page's broader definition and inclusion approach and its emphasis on scale, costs, and inequities support the heightened alarm about the chronic disease burden in the U.S. And here's your sources, guys. MSN, NIHCM, the American Action for United States Joint Economic Committee. Okay, that is A for you. I'll be back on later for B. So I will see everybody later for B. For now, Gator Wellness, take care, folks.